Auscultating lung sounds is essential for assessing respiratory function and detecting abnormalities. Let's break down the key lung sounds. Vesicular sounds, normal sound over most lung fields, soft, low-pitched, and heard during inspiration. These sounds indicate normal air movement in the alveoli. Bronchial sounds, normal over the trachea, loud, high-pitched, with a longer expiration than inspiration. Any other location suggests consolidation, like in pneumonia. Bronchovesicular sounds, normal between the scapulae and over the large airways. Medium-pitched with equal inspiration and expiration phases. If heard in other areas, it may indicate infiltration or fluid in the lungs. Adventitious sounds, abnormal sounds. Crackles, rails, fine popping sounds typically heard in the lower lung bases. They suggest fluid in the airways, seen in heart failure, pneumonia, or pulmonary edema. Wheezes, high-pitched sounds heard during expiration, often due to narrowed airways, seen in asthma, COPD, or bronchitis. Rhonchi, low-pitched wheezes, usually heard in the bronchi, caused by mucus or obstruction. Clearing with coughing suggests secretions. Stridor, harsh, high-pitched sound heard during inspiration, often due to upper airway obstruction, like in croup or foreign body aspiration. Nursing tips. Ensure correct patient positioning to enhance lung sound assessment. Use a bell for low-pitched sounds and a diaphragm for high-pitched sounds. Compare bilaterally and assess for symmetry in both inspiration and expiration. Proper auscultation helps guide treatment decisions, whether it's managing fluid, treating airway obstruction, or adjusting respiratory therapy. Stay sharp.